everyone. Welcome to another business showcase. This week we are showcasing the Health Hub at Eaton Fair, which was opened in 2019 by Craig and Hookham, who pride themselves on being family owned and community focused. Now, if you've ever been in there, you will know that they treat their staff and their patients as if they are family. It is a beautiful feeling. Now, something you may not know about them is that they won 3 awards in our 2020 Southwest Business Excellence Awards, and that was the Young Business Achiever Award, the Innovation Award, and the Emerging Business Award. So what an introduction, Craig. You guys have done a lot in just a couple of years. Thanks for joining me.
No worries. Thanks very much for having me.
So tell me, Craig, what led you to go out on your own? Because obviously you could have been a doctor anywhere. What made you start your own practice?
So I always had lots of ideas, big dreams, and decided that unless I made them become a reality, why I could. Who knows what the future had in store. So I just went for it. So Carleen and I decided, while we can, let's do it. And I couldn't find what I wanted out of my career anywhere else. So we did it ourselves.
That's awesome. So I think that's such a testament to what happens in the Southwest, because we see so many people who just go, I want to do it my ways, and they go and open it themselves. And, you know, I guess we see that a lot with the awards. So tell me, what makes your practice so different to everywhere else?
Yeah. So how we do things here, so we've got differences in lots of different ways, but when we first set up to design the place, we didn't want it to feel like a doctor's surgery when people came, because there's a lot of people, particularly children and some adults, have anxiety about being in a medical facility. And if it feels quite cold, sterile, like a hospital, that can bring back lots of negative emotions for them. So we made sure that it didn't feel like that, so people would come in and feel relaxed. Then the next step we wanted to work on was how people felt and how they were treated when they were here. So our staff, we employed all our staff based on their personalities and how they fitted with the team and how they fitted with our dream and our vision. Because I was always a believer that people can learn and people can train into any field that they want to be if it's somewhere they want to be. So that when patients were here, they were treated, with kindness, respect, and felt, like they were coming somewhere where they were familiar and like a family. So that by the time that they get in to see the doctor in the doctor's consultation room, they haven't come in with lots of built up negativity and emotions. So that automatically helps open up a lot of dialogue, helps us as a doctor establish a rapport, and get a lot more from the consultation with our patients, and particularly children. So children, we've got a kids play area that the children just love. And so the time they come into the room, sometimes they're talking about the play area and it's already broken the ice with us. And then how we focus on our care being very community focused as well. So we do a lot of community projects and really try and not just be the doctors, we also want to be part of the community. So I think that's, and I'm pretty proud of what we've achieved so far. And I think people feel that difference. We get comments from people all the time, like, oh, I can't believe that I'm at the doctor's, and how much nicer that makes them feel. And the best testament that I've had so far was a lady who said she'd had the worst week she'd ever had, but she came into my consultation room, she'd forgotten why she was actually here. So, which, it had provided therapy in itself just by her taking some time out and relaxing and feeling really welcomed.
Oh, that's so beautiful. So you also have a few other disciplines in your rooms, in your clinic. So let's talk about that. So there's obviously you and a couple of other doctors, but you also have some other people there with you.
Yep. So we've got some other businesses as well as other branches of our own business here. So we have a psychologist who comes, and her business is growing within ours already. So her demand has gone up. So she's expanding here with us. And we do some cosmetics as well and skin treatments, providing a different aspect of service that people want there. And we have visiting, we're just bringing in actually a child health nurse as well, who's going to be providing health assessments and things for children in an environment that's a bit more safe and familiar for parents as well. And so we've got lots of, more ideas there that we want to continue to grow, but we love having different specialties and allied health and other businesses within our business supporting what we do and giving us ideas as well as we grow. Yeah.
Perfect. So tell me, big dream for the next 12 months. What are you guys aiming for?
So we're focusing on certain parts of the business to grow and develop at the moment with COVID-19 vaccinations, which we are doing a lot of, which is great that we're doing that, but that is providing a large amount of our supplementary time into getting everybody vaccinated, but that's something that we obviously need to do as a medical profession. But yeah, we've got our new business that we've sort of been setting up called the Laser Hub here, which provides skin dermatology and anti-aging and some beauty services. So that's part of our business. And so we've already been introducing lots of new services and we're already growing and developing that. From a medical perspective, at the medical centre, we've got some new doctors starting. So we've got a new doctor starting in the next 6 months, and then another one starting in January next year. And they're all bringing in new skills, new personalities, new special interests, and all of those things will gradually build the core services that we offer our patients and our diversity, so that patients have more doctors and nurses to choose from when they come here.
Amazing. Now, one of your awards that you won was the Innovation Award. Now, one of your innovations that I personally love at your clinic is the drive-through flu vaccination clinic. Yes. That is a game changer. Did that just come from COVID, or were you planning that the whole time?
We had thought about it before, but it wasn't probably something. COVID allowed us to roll that process out in a way that was acceptable for people and made people feel safe and comfortable, because they didn't have to come into the medical centre. So from their perspective, they could avoid COVID, and we could keep people, mass numbers of people out of the clinic whilst doing a lot of flu vaccines. So they work really well. And people get a video message. This year, we've actually rolled out videos for all of our processes, and 24 hours before their appointment, they actually get a YouTube video, which we've got on our YouTube channel, explaining to them what they need to do, where they need to drive, where they need to park, how long they need to wait. And the process just works really well. So we get through large numbers of flu vaccines, and we did it again this year. Even though COVID, we probably could have done it in the clinic, but the feedback was that everybody wanted to continue with the drive-through flu shots. Unfortunately, we can't do that with COVID vaccines because they're a lot more complicated in our delivery, but definitely something we want to keep going for the flu vaccines.
Yeah, for the flu vaccine, it is very cool. And if you have kids who maybe don't like needles so much, not having to get out of the car, I think, is a total game changer for them. All right, Craig, well, let's wrap this up on your business. We are so excited to see what happens next.